Hello, I'm Patrick. I'm the EPSA Vice President of External Relations, and today I'm with Ian Banks. He is the Chairperson of the Patient Advisory Committee of the European Cancer Organization ECCO. Also, he's an EPSA Board of Trustees. Hey, Ian, could you maybe tell us a bit more about ECCO?
I'd be absolutely delighted, not least because I'm a trustee for your organisation, so I'm absolutely delighted that we've got this opportunity to introduce ECCO and its work, and also to introduce the role of the pharmacist in oncology. ECCO is a very large organisation and very influential organisation. It has 23 societies which cover just about every aspect of cancer. What's particularly fascinating though about those societies is that they're not all oncologists. They are a mixture. Not least we have psychologists, we have nurses, we have a huge range of organisations which together are much greater than the sum of the parts. And what I'm particularly delighted to be able to say is that the pharmacist is absolutely key to the work of ECCO, and pharmacy is represented in most of our committee structures, and particularly when we're representing ECCO to other organisations, not least the European Commission. But central also to ECCO is the Patient Advisory Committee, of which I'm the chair. I'm very delighted to be so, and it has 17 of the very most senior patient advocate organisations across Europe as part of its committee. And what is particularly important about ECCO is to know that it incorporates the patient's voice in every single aspect of its work. The chair of the Patient Advisory Committee, for instance, has a seat on the board and has voting rights. Now, there aren't many organisations who do that. So in other words, what ECCO is for is to improve the health and the well-being of cancer patients. That, in a nutshell, is what ECCO does.
That is what ECCO does. And what do you see as the role of the oncology pharmacist and how the pharmacist is contributing to quality care to cancer patients?
Yeah, what an excellent question, because pharmacy is central to the treatment of patients. There are very few, if any, cancers which don't require pharmacy in some shape or form. So the voice of the pharmacist is hugely important within ECCO and within the multidisciplinary team working with which ECCO is the champion, if you like, of taking forward. Because multidisciplinary teamwork is really the only way, the only sensible way, the only effective way of treating cancer. And that multidisciplinary team is getting larger as we recognise that we need a lot of expertise that formerly we never really thought of. So once upon a time, if you were a patient with cancer, you probably would only speak to a surgeon, because all we could do those days basically was cut the cancer out. And your only hope was that you did a big enough excision of that cancer, and you did it soon enough that the patient would actually survive. Things have changed so dramatically, and the pharmacist has been the central point of those changes, because now we have medicines which not only improve the outcome for cancer in terms of life expectancy, but also improve the quality of life of patients with cancer. And that is hugely important for the patient, because what patients want is normality. They don't want to be lying in a hospital bed, and pharmacy gives them that freedom to be able to have normality once again. So the role of the pharmacist is key, and advising doctors in terms of what's the best way forward is essential. Pharmacists will do 7 years training in pharmacology, doctors do 6 months. So who knows most about medicines?
So multidisciplinary team is the only effective way of effective quality cancer care.
Absolutely.
And what do you think gets in the way of the pharmacist providing that role?
I think there are a number of factors. You've touched on something which is obviously very controversial, and it has to, however, be addressed. And that is the basis of equality. On a multidisciplinary team, everybody is equal. You leave your ego outside the door when you walk into your multidisciplinary team, because each and every one has their own expertise. And what we know is by having these groups together, you get more value than simply the sum of the parts. And that is the essential feature of an MDT working team, or a multi-professional team, maybe it's the modern way of talking about it. But the pharmacist within that team has to have the respect of all the other members of that team. Now, what we know is this, is that the medical world, if you like, is fraught, is cursed with what's fraction, if you like, of ego and so on. And this gets in the way of recognising the value of other areas to do with medicine. And this has been, for instance, a slight against nurses in the past, for instance, that they weren't quite doctors kind of thing. Thankfully now, with multidisciplinary team working, that is rapidly becoming a thing of the past. So I think that the recognition of the value of each of the individuals, including the pharmacist and the expertise which they can provide, is essential if you're going to have an effective team. It used to be that it would always be the doctor who would be the lead on the multidisciplinary team. Now it's all changed. It's whoever's most appropriate from their background to be the lead on the multidisciplinary team. That could be the pharmacist, it could be the nurse, it could be the psychologist. It depends upon where the person is, the patient is, in terms of their pathway. So I think there are and have been blocks to the pharmacist, but I think the encouraging thing is that the pharmacist is now really starting to establish themselves as the central point, if you like, in many ways of the MDT working environment.
Thank you very much. And what would you say to the pharmaceutical students soon to enter the profession about the kind of future role they might play in cancer care?
Well, the first thing I would say to them is that well done, because you have timed your birth just exactly right, because this is the age of pharmacy. I mean, you come into the biggest growth area when you're talking about oncology and pharmacy, because without doubt pharmacy has taken us leaps and bounds from where we used to be when in the treatment of cancer. It really was a very simple world years ago, where surgery was the only option that you basically had with cancer. But now the complexity, the subtlety, the ingenuity and innovation which surrounds pharmacy makes it possibly and probably the most exciting area in oncology at the moment, because along with nuclear medicine, these leaps and bounds are going to take us to the point, and I prophesy this now, where we will be able to cure every cancer, and we will be able to prevent every cancer. And you may keep this film, and if I'm not correct, you can sue me.
Thank you very much, Ian. Thanks for these inspiring words and also promising words. And also, of course, thank you very much for this interview. Also, the viewer, thank you very much. And I wish you and the viewer a great day. Thank you very much.
Thank you very much, Patrick. Thank you.